Cultural and linguistic competence. The U.S. population is more diverse than ever before as a result of immigration and the increase in birth rate among different ethnically, culturally, and linguistically diverse groups. Most health professionals are from the mainstream culture, and their clients are often from a different social, economic, racial, or ethnic group. Thus, they need to know how to work effectively with individuals from different backgrounds and experiences. Dimensions of diversity. Dimensions of diversity usually refers to the diversity of an organization or community and the different traits, backgrounds, and abilities that each person brings. There are numerous dimensions of diversity: age, race, ethnicity, national background, first language, religion, education, immigration status, income, hierarchy or social status, mental and physical ability, marital status, children's status, military status, work experience, and political affiliation, to name a few. In many organizations, individuals bring diverse backgrounds and experiences that may differ from the majority, influencing how they feel and engage. Cultural competence. Social, cultural, ethnic, linguistic, and economic differences impact how individuals and groups communicate, access, and use health information and services. These differences may also present barriers to effective education and healthcare interventions. This is especially true if health professionals stereotype, misinterpret, make faulty assumptions, and mishandle their encounters with individuals and groups who are different from their backgrounds, experiences, and expectations. Healthcare professionals and organizations have their own culture and language. Many adopt the culture of medicine and the language of their specialty due to their training and work environment. Cultural competence refers to the ability to work effectively with individuals from different social, cultural, and ethnic backgrounds or in settings where several cultures coexist. It's an integral component of delivery of quality health services and can contribute to improved health literacy. It includes the ability to understand the language, culture, and behaviors of other individuals and groups and make appropriate recommendations. A common challenge occurs when health professionals introduce new practices or make recommendations without fully considering the client's own health beliefs and norms. This is often called a one-size-fits-all approach. A one-size-fits-all approach ultimately reduces the acceptance of the recommendation and the effectiveness of the treatment. Steps to cultural competence include: become culturally humble, acquire cultural knowledge, develop cross-cultural communication and counseling skills, translate cultural knowledge into pedagogical strategies, maintain cross-cultural awareness, and become agents of change. Become culturally humble. Cultural humility is a lifelong process of self reflection and self critique wherein individuals, particularly healthcare providers, seek to understand and respect different backgrounds, identities, and experiences. Health professionals need to develop a respectful partnership with each client through building trust and rapport, showing empathy and compassion, focusing on patient centered care, respecting patient autonomy and preferences, and creating a positive environment. They also should be willing to learn from others and be aware of your own background experiences and expectations, your comfort level with other groups, common social stereotypes, and your own beliefs and potential biases and prejudices. Acquire cultural knowledge. Actively seek opportunities to understand and appreciate different cultures. Be aware of how you and your culture may be viewed by others. Be willing to interact and share experiences with individuals from other cultures. And find common grounds with persons from other cultures. Develop communication and counseling skills. Consider learning another language using a translator or a translation app. Be aware of differences in nonverbal communication. Understand the stress and strain of living and functioning in different cultural settings. Be more flexible in your recommendations and embrace opportunities to collaborate and work with those from different backgrounds and experiences. And seek input on your progress. Translate cultural knowledge into pedagogical strategies. Educational institutions should align teaching approaches with different learning styles of the students. They also need to provide health interns and students with opportunities to practice their skills in and out of the classroom through role play, case studies, and games, media protocols, and field experiences and internships. Maintain cross cultural alertness. You can do this by building cultural bridges extending beyond professional boundaries and into your personal world. Remaining well informed about what is happening socially with the client population. And continuing to make incremental goals for improvement. Become agents of change. Commit to high standards of excellence and innovation in patient care. Enhance skills for personalized patient care. And develop skills in critical thinking and self reflection to identify areas for professional growth. Linguistic competence. For many individuals with limited English proficiency, the inability to communicate in English is the primary barrier to accessing health information and services. Linguistic competence includes the provision of readily available culturally appropriate oral and written language services to limited English proficiency clients. And these services can be provided by bilingual or bicultural staff, trained medical interpreters, qualified translators, or using a translation app or program. In conclusion, The ultimate goal of cultural and linguistic competence is to create a healthcare environment where every patient receives personalized, respectful, and effective care. Thank you for watching.